Dr. Dean Schweitzer from the Valencia Headache Care. And we've been talking, Doctor, about headaches, their causes, and what people may not realize their causes as being an imbalance of their jaw. And not so much anything else. It's not the kids in there practicing clarinets or anything else. That, especially when we're talking about chronic headache pain, not the kind that's just kind of a come and go kind of thing. And a little bit about the symptoms. And I want to talk and assessment. I want to talk a little bit about treatment because we've also used the analogy of the pebble in the shoe. So let's talk a little bit about that first.
What we have here is a situation where the imbalances in our bite create muscular imbalances, which then cause the pain. So let me give you a little visual because it's very illustrative. Imagine you have a pebble in the bottom of your shoe, and every time you take a step, it hurts. So your brain says, "Hey, don't step like that." So it directs your leg muscles to step differently and kind of limp around until you can get someplace to take the pebble out of your shoe. And then once you do, you walk and you're normal and everything's great. But what if you could never take it out? Imagine permanently having a pebble in the bottom of your shoe. Every time you step, you would step awkwardly, and it would cause your musculature to be strained. Eventually, it would be painful, and it would be permanent. That's what's happening in your jaw when you have an imbalance in your biting forces. Every time you bite down, your brain says, "Hey, don't bite there because that's not right," and it directs your facial muscles to find a better spot but it can't because it doesn't exist. So constantly, all the time, your facial and neck muscles, which control our jaw, are in turmoil, and they get constrained, constricted, unhealthy, scarred, and manifest as pain. So we need to correct those imbalances.
And we've talked also just briefly, you could have the most straight, perfect smile. You could have spent 3, 4, 5 years as a kid with braces and have the most beautiful smile
Absolutely.
and everything else, or you could and still have jaw imbalances, or you could have the most set of crooked teeth in the world and actually have balance. So it's not necessarily just how your teeth line up. It's the entire imbalance of.
And you can't feel it. It's not something you can say, "Oh, I feel like my
like you can't just go, there it is. Okay, yeah, I see. Yeah. It takes a professional.
Yes.
And what you mentioned though, just a little bit of a bite down on a sensor, so no major stuff. You're not going to pack anybody's mouth full of clay or anything like that to figure that out, which is really wonderful.
Very simple. You're going to bite on an electronic sensor that's completely comfortable. And literally within 10 seconds, we're going to have on our computer screen a complete digital mirror of everything that's going on in your bite.
And talking about some of the treatments, first of all, ultrasound. Tell me a little bit about that.
Well, we have to rehabilitate the muscles because the muscular dysfunction is what's causing the pain as a result of the imbalance in the biting force. So it's a combination of balancing out the bite with very imperceptible, very small, very minimal adjustments over a period of time. And then in combination with that, rehabilitating the muscles using proven techniques from sports medicine, ultrasonic therapy, deep tissue therapy, microcurrent therapy, and cold laser therapy. So at the end of our treatment, your muscles are healthy, your bite is in balance, and basically you're on your way.
And we're
it's like taking the pebble out of the shoe.
Right, and we're talking about treatment when we talk about return visits, or how long is the treatment phase?
So each visit is about an hour and a half for 12 consecutive weeks, but the treatment's very comfortable. It's basically like being in a spa treatment because we're rehabilitating your musculature. It's very comfortable. It's very relaxing. Most people or fall asleep even. And the adjustments that we're going to make to your teeth are very short and very comfortable. You don't even feel them. We're not doing dental work or rebuilding your teeth or moving your teeth around. We're just making very, very, very subtle adjustments as we course through the treatment, guided by our digital mapping that we've done.
And we're talking also like trigger point therapy, electrocurrent, but not electroshock therapy. I want to make that clear, right? So it's nothing that anybody is even feeling.
No, you don't feel it at all. But microcurrent therapy is proven over and over again in sports medicine to improve the circulation to musculature, which enhances the healing of muscles.
And that's important to understand. So first of all, not only is it something that is very comfortable but pain-free while you're going through the process.
Yeah.
So sometimes we get nervous about things like, are you gonna crack me? Are you gonna rebuild my jaw? Are you gonna take it off and set it straight? So no invasive surgeries, no medications as well, right?
That's correct. No medications, no injections. Our patients look forward to coming in for their appointments. It's probably the highlight of their week, to be honest with you, because after 2 to 4 sessions, they start to feel better, and they start to see, oh my God, this is actually making a difference in my life, and it's pretty satisfying to see.
And we're talking with Dr. Dean Schweitzer from Valencia Headache Care. And again, if you have a chronic headache, suffer from migraines, and I know people, doctor, who, because I fortunately have never had that sort of thing. Have I had headaches? Yes. Sometimes when I was younger, it was from a little too much of impetuous behavior the night before, but I've never suffered that. So it's not easy for me to understand when someone, I can't go out right now. I have to lay in a dark room with a cold, wet cloth over my face, and I'm so in pain right now that all I can do is cry. And so these are the people that, in those situations, should at least come down for your complimentary consultation.
Absolutely. They should come down to see us because I can relate to them, because I used to be that sufferer. I used to be in a dark room with ice on my head and missing fun things in my life, and I no longer have that. So you should definitely come down and see us. We have a complimentary 15-minute consultation so you can at least meet us, understand what we do, and see how we can help you.
And the website, valenciaheadachecare.com, and you can also call 287-9667, 287-9667. We also have this information on our website at hometownstation.com. We're going to take a quick break. When we come back, though, we're going to talk with Dr. Schweitzer about some of the testimonials and some of the things that people had to say about the relief that you've provided them from Valencia Headache Care.